Jim Gast, family medicine. I chose family practice because it gave me the opportunity to deal with many different facets of medicine and medical practice on a daily basis. From one patient to the next, I can see very different things from room to room. I can see a 90-year-old with a heart problem, and in the next room see a newborn that I delivered 3 days ago. Baby's still moving, still active quite a bit.
Very.
Worse at nighttime.
Yes.
I do take care of anywhere from 30 upwards of 50 deliveries per year. One of the nicest things about my practice is being able to take care of a pregnancy, follow the pregnancy, deliver the baby, and watch the child grow over the years. One of the things I like to do with my practice is really get to know the patients. That's one of the benefits of family practice, is that we can take care of the mother, the father, the children, their parents, so you really get to see the interaction of the whole family as a whole. And that's about 141 beats per minute. Sounds like a happy little girl in there. One of the big things I do as far as communication with patients of all ages is I try to let them forget that I'm a physician. Do you like to watch TV? No. You don't like to watch TV? I try to put people at ease before I get into any of the nuts and bolts of why they're there. The other component that I really try to do is make sure the patient has enough time to talk about their concerns. Really wide, like there's a big hamburger coming. I have 3 children. My oldest child is in the preteen years, and I've seen everything up through that point. I have the experience of having 3 children go through that. I've been there. Boys, girls, younger, I've been there, and I know what you're going through with that. A first visit for me, if they're coming in for whether it's an acute visit, such as a sinus infection or pneumonia, or whether it's a chronic disease visit, or maybe even a physical exam, one of the first things I'm going to try to do is get to know that person, where they're from, if they're working in the area, if they're a student, if it's a child, how school has been going, what their interests are outside of school, what they like to do with their free time. But I really try to let the patient do most of the talking during that first visit, and I'll just ask the pointed questions to kind of get the information that I need from them. The staff that I get to work with here, everyone from the front desk to medical records to the other physicians here, everybody is top-notch. We have a very low-key, a very fun atmosphere to work at here. If I'm not having fun, something's wrong, and I try to let everybody else have fun as well, not only the patients, but the people I work with as well. The best moments that I have as a physician is when somebody comes to me and says, I'm here to see you today because of somebody else that you see on a regular basis. The patient-to-patient referral to me means that I'm doing something right.